Please, sir, I still need your take on the current state of Nigerian health system. Going by what Nigeria as a country has been faced in terms of JAPA syndrome. Not only JAPA at the level of human capital, but even at the level of resources needed for the healthcare. Most of the drugs coming to the country today are coming from Asian countries of China and India. So as a distinguished former lawmaker and of course the chairman of a powerful agency, NHIA, and of course a former senator, please, what is your take about this? How can Nigeria as a country address this? Minding you that we have over 200 million people. And one critical thing for these 200 million people is that health security is sacrosanct. We cannot do away with it. So, sir, what is your take about that?
Well, I think you put several issues in one. Let me try and one by one. Well, of course, generally, anybody within the sector space in Nigeria will definitely say we are not satisfied with the situation of the health sector. Now, you've mentioned about 3 or 4 critical elements of what we call the pillars of health system. You mentioned the issue of human resources, you mentioned the issue of drugs and supply, you mentioned the issue of financial accessibility, and of course, quality of service.
Yeah.
On each of these 4, we have a lot of challenges. But what I want to say is that I'm very much aware that the current president, under his renewed hope agenda, the health sector renewed hope agenda, which I have a privilege of being part of those that put what the policy will be together. I've started to implement things in this area. One on this of HR, this is human resources, or what we call human capital, where we have people drifting out, which we call JAPA. The government, since 2023, have started to implement certain things that will make us to reduce the impact and effect of that. One, as we know, it's a human rights issue. You cannot stop anybody from seeking job anywhere. You can't if you state like that. It's against the fundamental right of the human being.
Yes.
Because as an human being, you have a freedom to say, I want to work here in this town, I want to move to another place.
Yes.
However, why it is affecting us is because we don't have enough. So one of the ways through which we can address the JAPA is to be able to increase production.
Right.
So a simple economic terms, if your supply is higher than your demand, of course you'll be able to get a positive effect. But now the demand is far outstripped the supply. So what is there is that what we are producing is not even enough before. And out of this, there are enough people who are. So what the government has done is to increase production capacity, particularly for nurses and medical. They have approved very many more colleges of nurses to expand the number of nurses we can produce. It's the same thing with the doctor. They try to increase or strengthen the capacity of the facilities that are training institutions. This government has been able to do that. The figure has increased. But of course, that alone will not solve the problem. Because if the motivation is not there, because that's the second factor, what makes people to go out more is either 3 or some are what we call issues that are within the health sector and which without. Within the health sector itself includes salary, includes equipment and facilities that enable them to work, but without is include the issue of security. Because health workers are top level in any society class of workers. So when there is insecurity, because they have potential and opportunity outside, they move. Of course, the other one is working environment. I mentioned equipment, but there are other working environment. Where would they put their children to go to school? Do they have some other incentives, accommodation, vehicles, and so on? So the current government is addressing all these issues in several ways. Particularly, they are be able to ensure, you can see that in the last 2 years we've not had any strike, because most of what is due to the health workers have been paid to them and they are more down. So they're also improving, particularly in rural areas, improving environment by providing accommodation and so on for nurses and primary healthcare workers. So, of course, the issue of salary is not peculiar to the health sector. It's a national issue. Because the salary of a health worker is relative to the general salary that's paid to people. So if you cannot unilaterally just increase health worker salary, other sectors will come up. But the government is trying to find a way of addressing by allocating, by creating some new allowances. And of course, as you know, the current minister also, who is the coordinating minister, has created what they call health fellows. For each of the local government, they want to train people who will be like a local government coordinators for health activities. That's addressing the human resource. On the drug, one of the key reform that is under the renewable agenda is the issue of increasing local production and bringing production down to the country. There is a specific special advisor, or national coordinator for that particular activity is one of Dr. in the Federal Ministry of Health. The guy, he was brought in from African American Bank to come up for it. He's doing something like that before. And they have about, I think it's a 7 or 8 point agenda which they are following. The essential thing is to be able to say we are not producing things that will enable us to even produce drugs. We call something API.
Yes.
So the API, it was only one factory that was starting it before, but now they are be able to expand access to enable more people to produce. 2 is to be able to link the producer in the country with technical partner outside. So as technical partner, they can bring in their their know-how to partner with the local producer of drugs so that we can produce drug locally instead of importing. Then the government is deliberately providing special funding for local producer of drugs to be able to produce more. There are several other activities that that particular body is doing. So the government is addressing the issue of production because during COVID, we lacked the challenge of this when everywhere was closed. We can't even get, so even if you want to have your money, you can't buy it because there's no way to transport it. So we need to be self-sufficient. And we are just about 20, we are only producing 20% of the drug we need. That is unacceptable. So the plan is that I think in the next 5 years, we have to move to at least be able to produce 60% of what we need. So this is going on in that. So of course, the other area is the issue of financial access, which is, one of the key challenges in the country is that because of the general poor level of economic situation, we have more poor people. We said almost 70% of our population lives below poverty line. So these people mean they don't have even resources to dip. There's no pocket for them to dip hands in to be able to seek access. So the National Health Insurance Act provided for what we call vulnerable group fund. The basic healthcare protection fund is to fund vulnerable group as well. So the current government is putting these two together to address certain key vulnerable issues, particularly those ones that bring our health indices down. So there's what we call CMOP, which is comprehensive emergency maternal and obstetric care, and there's also the care for people with fistula. That comprehensive maternal child health care is to be able to take care of women in pregnancy, to be able to give free access to cesarean section where necessary, free delivery, and free child health care. So the government is able to seek resources to do that. But far and beyond that, the basic healthcare provision fund is being repackaged according to what I saw the ministry is doing to be able to increase insurance access to the poor. But there is more that needs to be done. But the hope is that in the next few years, the effect of this will be reflected in our indices. So, of course, quality of service is very important. And I think both for those that are insured and not insured, the government is setting up in the Federal Ministry of Health what they call a quality standard and quality assurance committee that we set out what are the standards for each hospital, and we set up monitoring mechanism. This is still in the process, but it's hope that if it's implemented, things will be better. So I could say that when you say my take, I think we are doing some things that are right now, and let's hope in the next few years they will coalesce to deliver the results.
Thank you so much. Thank you very much.
All right. Let me now ask another question. You have spoken a lot about a lot of things. Even you've answered some of the questions I wanted to ask. Talk about mortality rate and all this. But you say I want to tell you a story of myself. Some time ago, I'm a civil servant. I had malaria. I went to one of our clinics in my area, and they were asking for 10,000 naira. I couldn't afford it. And the next thing I did was to go and buy concussion, 1,500 naira. And I used it, and I was okay. Later, when I was having a lot of advocacy from friends, and I had, because we do not know the dose we are to use, it might affect my liver, kidney, and before I know it, we started losing loved one because they don't have money for kidney transfer, they were having liver issues and all this. Nobody knows what happened. Now my question is, you are the chairman of NHIA now. What are the weaknesses and strengths of the agency to the common man?
Yes, I will answer it in this way. The agency so far, as we know, in terms of coverage, the coverage is very poor, between 3 to 5% of the population, and that means it's not starting. Because if you score 5% in an exam, it's beyond that you have failed.
Yes, sir.
And the reason is because the focus and the resources that are available has been only for federal civil servants. Now, unfortunately, even that one is not delivering the expected quality, because the quality of service is poor. The quality of service received by beneficiary. So therefore, for us to be able to make NHI beneficial to common man, we have to expand the coverage. Now, there are 3 levels of coverage that has to be expanded. One, of course, what we call the formal sector. The formal sector is both those that are in government and the organized private sector. For the government, at the federal level, they've covered almost 90%. But state level, many states have not covered. As you say, you're a civil servant, you only need to pay that. Then I'm trying to use your story now to say you are not common because you are in the formal sector. A common person is somebody that is, which I'll come to later, which is the third level.
Right.
So, but for you, if your state had established a state health insurance scheme or contributed insurance scheme, then you won't have to be asked to cover 10,000 to treat malaria or to treat whatever you thought, because you assume you are led this malaria, you assume not diagnosis. Because even the 10,000 to me may not offer you quality service, because I'm sure there may not be laboratory test in that your 10,000. It is only assumed because you have fever, what we call it's a diagnosis based on commonality, not based on fact.
Yes,
they didn't take your blood to see whether you have hair. So, one, it means for the NHI to be beneficial to people like you, the NHI has to engage with the state. The law stated it. Every state should set up a state insurance scheme for the resident in that state. Not only when you say resident, it means civil servant and non civil servant. So that's the second aspect of the formal sector. The third aspect of the formal sector is the organized private sector. And the organized private sector includes anybody that is employing people. One of the things that we intend to work with NHIA to achieve as chairman of council is to give effect to the intent of that law, making insurance mandatory. Like, we want to introduce a system where every company, every organized private sector that recruit or that in employment persons 10 and above must obtain insurance for them, must pay, and then must organize, because it's a co-contribution. So with that, you can imagine how we're going to expand and make insurance available for what those who describe as common man. That means everybody's common. But that's, I'm talking about the formal sector.
Yes, sir.
But we have huge non-formal sector in Nigeria. Your bricklayers, your vulcanizers, your carpenters, your everything, and the traders. They all have sources of income.
Yes, sir.
Don't they?
Yeah.
But they lack the awareness to say you have to prepare for health. The reason for this is that we have a culture in this country that, hey, I will want to speak about to say all over the rare that if now I have that, may God prevent me from having sickness. But what we know is not like somebody say, oh, all over the Enrico, may God prevent me from dying. But we know death is a must for every human being. You get my point? Yes, sickness is also a must for most human beings.
Yes, sir.
So the only thing which we have to do is to prepare for it, so that when it comes, it doesn't put us in a catastrophic situation. So it means if you're a bricklayer, you're a carpenter, you're a trader, or whatever kind of artisans you do, as far as you earn income, a small portion of that income you should invest it for your health and for the health of your family. And that, if you are able to do that, every common man or woman, as you said, will not have the things. If you have paid the essence of the health insurance and kind of other insurance is a pool. It means if all of us, if we have 100 people, if 100 people pay, it may be only 10 of them that will get sickness. But the 100 has paid for that 10. So who will be among that 10? We don't know. It's a probability chance. It's like what we call a chance. You put 10, you put 100 dice in this time. You want to pick. So who you pick, you can't know. Who it will affect, we don't know. But all of us have to, that's it, you have to be your brothers or sisters keeper. So one of the things NHI will do to be able to make it impactful or common is to see how we proactively bring the informal sector on board. There are various ways through which that is done. They've made some attempt before, but we have to strengthen it. Like if you ask me, like even particularly where we are talking now, every artisan association, every magazine, they have a union, don't they?
Yeah, so
Breakdown association, capital association, and so on. Those they are union. Because they are all in similar trade, they can come together. They form what we call a mutual. That is, they buy insurance for their members. It will be a small premium that they need to pay. But once they pay, it is pulled together.
Small premium.
Yes, it's small because that is a small premium. For example,
at the end of the day, it might not be small for the common man.
No, not common. Not this common. It's well, hold on. I'm coming to. Well, I'm talking about people that earn income.
Alright.
Everybody in the farmer sector earn income.
Yes, sir.
If, for example, you are supposed to pay 15,000 per annum as premium for yourself, if you divide it by 12, it's less than 1.5.
If it is like that, it is still very okay.
That's for the person.
Mm.
So such a